After the operation, it would be normal for most patients to need some mild painkillers in the first week or so. That'll be very much at the discretion of the patient, but certainly it would be normal to be on some painkillers to start off with. Patients will also complete a course of antibiotics that they started before the operation, and infection is the thing we have to be very careful with implanted devices. So they start antibiotics before the operation, have intravenous antibiotics during their time in hospital, and then complete the oral antibiotics afterwards. Most patients could look forward to returning to normal sexual activity with their penile implant certainly by 6 weeks, and some as early as 3 weeks after the operation. A penile implant won't interfere with a man's ability to pass urine. In the first 24 hours or so, when the penis is a little bit swollen, he may notice that his flow of urine's a little slower, but once all of that settles down, he should return to passing urine exactly as he did before. He doesn't have an increased risk of urinary infections with a penile implant in situ. He can still go on and have procedures that involve telescopes into the bladder, etc. So it really doesn't interfere with any of the urinary functions either now or anything that may happen in the future. When a man's having sex with a penile implant in, his partner won't really be aware that he has a penile implant. All they'll know is that he has a very hard, firm erection. Now, if the partner was to feel the patient's penis with their hand or feel the scrotum, they may be aware of the components within the penis or within the scrotum, but in terms of actual sexual activity, the partner won't have any awareness that the patient has a penile implant. The patient's partner won't be able to feel any of the tubes. It won't annoy them or worry them or hurt them in any way. And indeed, they won't really be able to feel the patient has a penile implant in when they're having sexual activity. If the partner was to actually examine the patient at any time, they would be able to feel that there's a pump in the scrotum, which is a little ball that sits between the testicles. But apart from that, there's nothing they would really be able to feel, and certainly during sex, they won't have any awareness that the patient has any implant in place at all. The great majority of patients with a penile implant in don't even really have an awareness they have an implant in during their normal day-to-day activities. Sitting around, walking around, they can't feel the implant. They have to physically actually feel for it when they want to inflate it. So certainly there's no need for them to feel that they're strange or robotic or anything along those lines. They are able to have a good erection by pumping the implant up. The penis looks normal, it feels warm, it's hard. When the implant is deflated, the patient really doesn't have any feeling they have anything inside them at all. Some patients have been concerned that it may affect their partner in the sense that the partner feels that the patient's not being sexually excited by them. Now, in fact, sexual excitement is a lot to do with what's happening in the brain and all those stimulations and those things that happen normally, and that certainly won't change with an implant. The actual sensation of the penis and the ability to have an orgasm is largely to do with touch and sensation, and again, that won't change with an implant. So I think men who are concerned that their partners will feel less involved in the process should really not have that thought. It's obviously just as important as it ever was, only now the man has got a functioning erection, so he's able to have more normal and satisfactory and satisfying sexual relationships. Most men would like to think that we can make their penis as long as possible, and particularly if we're putting a penile implant into place, they say, well, why can't we do that? Unfortunately, the way the penis is and the changes that may already have occurred inside the penis from the erectile dysfunction mean that we certainly can't make the penis longer than it was. We're limited by the actual elasticity and the size of the cavities in the penis as to the length of implant we can put into the patient. The mechanical reliability of penile implants is really excellent. It's very, very unusual to see any sort of mechanical problem within the first 10 years, and even out to 15 or more years after a penile implant, it is unusual for a mechanical problem to develop. If unfortunately a man does get a mechanical problem, it's usually a small hole that has developed and the fluid is lost out of the system, meaning it won't inflate. and it's quite easy and a much smaller operation than the original operation to replace the part that's broken. The penile implants are guaranteed for life by the companies that manufacture them, so it's quite an easy process for us to replace the part that's not working, but it really is a very small problem in the first 10 to 15 years. If a man needs a revision of an implant because it's failed, the cost of the implant is certainly guaranteed by the company. They do have a lifetime guarantee on them, but the other costs, that is being in hospital, and the medical costs, will still be the responsibility of the patient. In the Australian health system, penile implants are fully covered by the private health funds. So the cost of the implant, the associated surgery, the time in hospital is regarded just like any other operation, and through a combination of Medicare and the private health funds it's covered. In the public health system there is some availability of penile prostheses, but because of the cost of them, the number that are allowed to be done every year in the public hospitals in Australia is quite limited. When it comes to talking about the cost of a penile implant operation, there are really three areas of cost. The cost of the implant itself, the cost of being in hospital and being in the operating theatre, and the medical costs, that is the surgeon and the anaesthetist. In the Australian health system, the cost of the implant is covered by private health funds, like any other implant or device that's put inside the body, so that's not an issue for patients. The hospital costs, that is the stay in hospital and the operating theatre costs, are covered by private health funds, so patients are treated in private hospitals to have their penile implant. And the medical costs will be covered by a combination of Medicare and the patient's private health fund. Depending on how much the surgeon charges for the implant, there may be a gap to pay, but that'll need to be an individual discussion with the surgeon and the patient. If a patient's concerned that their private health insurance company will cover a penile implant, they can rest assured that essentially all Australian health funds do so. Nevertheless, if they want to be certain, they can speak to the urologist who'll be doing their operation, and the urologist staff can provide them with the item numbers, that is the code numbers that are used for a penile implant, and the patient could then approach their health fund with those item numbers to be reassured that it will be covered by their health fund. The thing that implanting urologists are most concerned about when we operate on a patient and place a penile implant is the risk of infection. If you put any artificial material inside a patient, and this would apply to any sort of implant, heart valves, new hips, etc., the concern is whether bacteria from the skin get into the wound and onto the implant at the time of surgery. We take every possible precaution to avoid that. That is, we have the patients on antibiotics before their operation. We get them to use antiseptic soap for several days before surgery. They have washes with antiseptics when they arrive at hospital. We make sure they don't have any skin lesions such as pimples or boils. We use very strong antiseptics at the time of the operation. We wash out the operative wound with antibiotics. So every possible precaution's taken, and indeed the thing that really helps us now is that the implants are either impregnated or are able to be soaked in an antibiotic solution, so when the implant's put into the patient there are antibiotics on the implant. So with all those steps the risk of infection is very, very low. Unfortunately it's not zero, but something like 1 to 1.5% of patients will unfortunately develop an infected implant. Now in most cases that won't be a severe infection. The patient won't be unwell, they won't be sick, they won't have a temperature, but the implant becomes infected, the patient is uncomfortable, the wound doesn't heal as it should, and in that situation we may need to remove the implant. In that situation, if we remove the implant, there's quite a good chance we can wash all the spaces out with antibiotics and antiseptics and put a brand new implant in at the time and salvage the situation. And that would certainly be the thing we would try and do in those very small number of patients that do get an infection. If you consider what